Welcome everybody. This is the information session for the Population Health and Place Ph.D. program. This is an interdisciplinary degree that's hosted by the Department of Population and Public Health Sciences, the Department of Sociology, and the Spatial Sciences Institute. And first I'm going to introduce the three presenters and then talk about the three academic units. And then there's a whole cadence that you can see on the next slide. So next slide, please, Jesse. So I have two guests with me. One of the ways you can be successful in life is to surround yourself with people that are more accomplished than you yourself are. So that's the case today. We have three students that are current students in the program with us as well. And we'll speak about both the students, the faculty that participate in the program, and selection of our graduates. So I'm John Wilson. Next slide. I'm John Wilson. I'm a professor of spatial sciences, sociology, architecture, population and public health sciences, computer science, civil environmental engineering. Now, there's a reason that I'm going to tell you that. I don't normally say all of that in one sentence. But when I come to talk about the faculty, there's a special role I have, and I often think of myself as a deep generalist, which means I can sit in a room with a lot of different people with different backgrounds, different interests, and I know enough to ask intelligent questions to build a project and to execute a project where the sum of the parts is more than the parts. If you like this program, I was the original proposer, the original author. So if there's something you like, I might have had some hand in that. If there's something you don't like, then surely that was my work all by myself. So that's how we're thinking of this. So my two accomplished colleagues, Rima Habre is an associate professor of environmental health and spatial sciences. Her interests cover air pollution and climate change, exposure science, exposomics, maternal and child health, environmental health disparities, census, and M-health. And the second guest is Laura Ferguson, who's Associate Professor of Population and Public Health Sciences. And her interests span health systems, health services, human rights, and health outcomes, sub-Saharan Africa issues, including HIV, AIDS, sexual and reproductive health, and child health. And so immediately, just by me introducing three of the active faculty in this program, there's a lot of different interests. Their list was longer than mine because I'm actually interested in everything. And so I simply list GIS, geodesign, spatial analysis, environmental modeling, and public health. Okay, so that's who's going to be speaking today and capable of course, answering questions. So let me talk about the three pillars here, population, health, and place. Next slide. So I'll start with population. And so this includes faculty from a range of departments. When the program was initially imagined by me and some close colleagues, the focus was on the USC Department of Sociology. It's a long-standing department, quite accomplished. It was founded in 1915. But there are key faculty as well in the USC Suzanne Dorp Peck School of Social Work, which was founded in 1920. The USC Leonard Davis School of Gerontology that was founded in 1975 and is likely the world's first, well, was the first, and is the largest and perhaps most renowned educational institution focused on aging in the world. And then there's a group of people that are trained in demography with interests in demography and families and gender and immigration, labor, race, ethnicity, and religion in the USC Department of Population and Public Health Sciences, which was founded under 1977. But for the longest time used the name the Department of Preventive Medicine. So we go to the second pillar. Next slide, please. So this is health. And this is focused around the Keck School of Medicine, Department of Population and Public Health Sciences. It's probably one of the two largest departments, two or three largest departments in the whole university. The rivals might be the Department of Computer Science and Department of Biological Sciences in the Turbine Northside, for example. There's 125 plus faculty divided spanning 6 divisions, so bioinformatics, biostatistics, disease prevention, policy and global health, environmental health, epidemiology and genetics, and health behavior research. And they are, like many medical schools across the country, a large research as well as teaching enterprise. They rank 2nd in population health research funding from the National Institutes of Health. And there are 2 main campuses for USC. We're sitting today in a building on the University Park campus. There's a second campus, maybe 6-7 miles away in a northeast direction from where I'm sitting. That's the Health Sciences campus. And then a good brisk 10-minute walk from the Health Sciences campus is the Soto Street building. And this is where the largest part of the Department of Population and Public Health Sciences is situated. And then third, next slide, please. There is this idea of place. And this is largely delivered by Spatial Sciences Institute, but departments are just ways to organize a university. And so there are people that have common interests, sometimes common training that are spread across many different parts of the university. And that's true for all of these 3 domains here. So the Spatial Sciences Institute was founded in July 1st, 2010, grown rapidly in the last 14 years. There's today 13 full-time interdisciplinary faculty. There are 43 faculty affiliates, of which Laura and Rima are 2. And there's 11 full-time admin and research staff. We have a central location on the University Park campus. We have faculty and staff offices as well as state-of-the-art teaching spaces. We offer academic programs for undergraduates, masters, and this Ph.D. We have a substantial research enterprise, and in order to support both the teaching and that research enterprise, we have a ever-expanding computing infrastructure. And Spatial Sciences is the administrative home of the Population Health and Place Ph.D. program. And this is possibly one of 2 interdisciplinary PhDs on campus, the other being neuroscience. Okay, next slide, please. Now, what we've done from the outset to the present day that's worked pretty well for us is that we have identified a group of faculty who have training and interests that would bring something important and meaningful to an interdisciplinary population, interdisciplinary PhD degree in population health and place. And we have asked each of the faculty members to be part of one of 3 lists. So you can either be in the population column, or you can be in the health column, or you can be in the place column, right? Now, given the number of places that I roam on campus, conceivably I might be in 2 or 3 of those columns, but I'm only personally in the place column. So that's not to say I don't know something about those other domains. And in fact, I would think of all of the faculty on this page and the next series of pages I show you could likely have meaningful and important things to say and advice that could span all 3 pillars of this interdisciplinary degree, right? But there's a lot of, this is a big, ambitious university, and there's a lot of talent here, and we've tried to collect an A team to support students and PhD candidates and graduates that are affiliated with this degree program. So on this page here, we have somebody from the Marshall School of Business, Paul Adler. We have somebody from the Gerontology School, Jennifer Elshire, from Public Health, Population and Public Health Sciences, Lourdes Bezacondi, Tracy Baston, Timothy Biblas is the chair of the Sociology Department. John Bloshnik is in the School of Social Work, I think. And Ricky Blumenfeld is is he the acting chair of?
Yes.
Yes,
The acting
of
chair.
Population and Public Health Sciences, right? Now, to be fair, some of these people were handpicked and invited by us, and some people just put their hand up and said, well, I want to be part of this, right? But anybody on this and the next 4 or 5 slides have been and continue to be active participants in this program. So next, Jesse. So here's another list. I'm not going to read through all the names, but I'll just tell you that the first name is Population and Public Health Sciences, Sociology, the Division Chief for Environmental Epidemiology, Population and Public Health Sciences, Kayla Delahey now is part of the Centre for Economic and Social Research here on Dorset College. Juan Delara is a faculty member in American Studies and Ethnicity. Genevieve and Laura are part of Population and Public Health Sciences. Next. Brian Finch is with CSER, Centre for Economic and Social Research. James Gauderman, Sophia Gruskin, part of Population and Public Health Sciences. Daniel Hackman, Social Work. Rima, of course, Population and Public Health Sciences. Next. Jennifer Hook is Sociology, Gopeng Wang is Spatial Sciences, Catherine Lester is Spatial Sciences, Li Wai Lu is Population and Public Health Sciences, Laura is Spatial Sciences, Rob McConnell and Kimberly Miller are both Population and Public Health Sciences. Next. So these are in alphabetical order, so they just go through like this. So I'm going to stop talking about them here, at least about every person here, but we have some of the most accomplished faculty on campus. Manuel Pastor, for example, is the founding director of the Equity Research Centre, faculty member in the Department of Sociology, and more importantly, a university professor. So he's one of the most accomplished faculty on campus. Next. And so more, again, from all 3 places. So the 3 pillars are roughly equal in terms of their composition. And next. And there's me, again, with some colleagues that are in some ways more accomplished than me. Next. And that's the end of the list. And so currently there are 47 faculty who have put their hand up and by words and action contribute to this program, right? It's been very successful in that regard. Okay, so next we're going to switch to research opportunities, because fundamentally a PhD is about research. We're fortunate across the university that there are a lot of ambitious, talented faculty, and so there are lots of centres. So a centre here is a group of faculty with a set of common goals, complementary skills and interests that working together can produce an outcome that's the sum is bigger than the parts. And so Rima is the PI of a just funded climate-related exposures, adaptation and health equity centre. Michael Goran at CHLA is the lead faculty for a Southern California Center for Chronic Health Disparities in Latino Children and Families. I was at the site meeting yesterday for the site visit for the Southern California Clinical and Translational Science Institute. Rima and I have prominent roles around exposure science in the Southern California Environmental Health Sciences Center. Laura, our other guest today, is a key part of the leadership team in the USC Institute on Inequalities in Global Health. We've made reference to several faculty in the Leonard Davis School of Gerontology, and Rima is also one of the leaders of the USC Madry Center for Environmental Health Disparities. And so not all of these kinds of centers will be equally attractive to each and every student. But the point to make here is that there are lots of different opportunities, and we're broadly focused on human health and human well-being. And I've got optimism that any particular person whose broad interests are something around that could find a group of colleagues, a group of students for which they would share many affinities and complementary skills and interests so that they could work either alone or in teams as they saw fit. So next, Laura, this is you.
Great, thanks, John. So I just wanted to talk a little bit about some of the research projects that I have been working on with students over the years to give a sense of some of the types of projects within the Institute on Inequalities in Global Health that students can engage with. And you'll see that they're all very different. The first one is some work that I've been doing for the United Nations Population Fund, UNFPA, where we've been really trying to look at the links between laws and policies and sexual and reproductive autonomy and sexual and reproductive health outcomes. I'm trying to figure out like what is going on in these pathways between laws and policies, autonomy and outcomes. And to be honest, it's been ongoing for years, and we've had students involved at different points. Some of it in terms of legal and policy analysis, because people want that experience. Some of it looking at qualitative data. We did primary data collection with government, civil society, UN agencies in 4 different countries to try and get at this. And then most recently, with a PhD student, we did some moderation analyses using DHS data to look at why some women who have reproductive autonomy can translate that into better sexual and reproductive health outcomes and why some can't, and like what are the factors that are going on within that. And the only reason to do any of this is to get to what are the implications for how we address these things in the world. And the beauty of working with a UN agency is they're really well placed to do that. So we come up with recommendations about the type of data they should be collecting, about the types of laws and policies they should be promoting, and really about how to move towards implementation at the national level.
Info session or not?
Yes.
I was going to do lab, but I think it's more pertinent. No, you remember from the first time. Way back. I didn't have like that.
Okay, so that's one project. As I say, these really different types, these different ways of engagement. Another project that is ongoing right now is that we are trying to understand and improve young people's sexual health, sexual rights, and sexual pleasure, both in Los Angeles and in Brazil. So again, we've actually got similar components: legal and policy, qualitative, and we will be doing some quantitative survey work. And I think from a spatial perspective, there's really interesting analyses to be done comparing the different parts of LA, the data that we're collecting from different populations, different places here, and the same in Brazil, in Sao Paulo, but then looking at comparing the 2 cities. So there's a lot of scope, I think, for bringing in students to engage in that kind of stuff. Another project that I'm working on actually with colleagues from the School of Engineering is using machine learning to forecast acute malnutrition among children in Kenya. We've basically developed a model that can now do this to a pretty specific geographic location, and we're working with the government to have that incorporated into their ongoing nutrition response across Kenya. But we're also working with them to figure out how do we monitor the impact of that moving forwards? So again, it's like really interesting spatial work to be done around this work that also brings in the public health side of nutrition, but also the engineering side of AI and machine learning. And then one other totally different project that I'm doing is about zoonotic disease surveillance and response in Uganda. This is a huge project. We have mountains of data, lots of georeference data from all over the country, looking at disease prevalence amongst humans and animals, as well as social science data that's looking at sort of more social, community, legal and policy factors as they're affecting disease spread. So I use these as examples of ongoing research that I'm doing where we have pretty large data sets and different types of data that will offer opportunities for student engagement. But the other thing I think is really important to think about is look, there's massive data sets that exist in the world that can be leveraged for spatial analysis. And another way to think about engaging any of the 47 faculty that John is talking about is to think about the different skill sets that we bring. Like, I am not a quantitative person. I'm not going to help you with geospatial analysis. But if you have interest in laws and policies, if you have interest in qualitative data, if you have interest in trying to figure out how you bring all of this together with quantitative data, I'm totally in, right? And so just to sort of flag that there are different ways of thinking about how you engage with the different faculty. Part of it is substantive. Like you might look at this and be like, oh yeah, sexual health, I love that, I want to do that. Or you might be like, zero interest in that, but zoonoses are totally my jam, and so that's what I want to do, right? So there's a substantive thing, but there's the methods thing. And I think one thing that's really important about this PhD program is that you have a chance to develop very different methodological skills across disciplines, and that you have this enormous pool of faculty who you can draw on to make sure that you have good mentorship in skills building, not just in the different substantive areas. So I will stop there.
Right, thank you.
Thank you.
So Rima, I think the next slide is yours, correct?
Yes, thank you so much. And I completely agree with Dr. Ferguson. Hopefully you guys can hear me okay.
Yeah.
Thank you. Very nice to meet you all online, and thank you for being here and for the invitation. I'm going to talk to you about a couple of examples of research I have had really the honor to work on and develop with PhD students, most commonly co-mentoring them with John or serving on committees in different capacities. But in the environmental health space, there are so many opportunities for you to be involved in research. One theme is environmental justice or environmental health disparities, and thinking about how, let's say, certain individuals or communities or populations may be at a disadvantage in terms of how much air pollution or environmental contamination or other sort of bad conditions they are exposed to in their neighborhoods where they live, where they work, where they go to school, and what that does to their health. And so, as John mentioned earlier, we have a pregnancy cohort where we basically recruit pregnant women from hospitals in urban neighborhoods of LA, and we follow them up over time, including the babies once they're born. And we try to do these very sort of spatio-temporally elegant, but like deep characterizations of everything they are experiencing in the environment. This is what we call sort of cumulative impacts research, where we think, it's not just one chemical, for example, that might be acting independently. It's probably a lot of chronic stressors and factors that come together to influence health. And what is that doing to the mother's health, to the baby's health once they're born, to their growth over time, etc. So, we've had quite a few different projects that we've worked on with PhD students, and it's really always a very sort of engaging and fun experience. The other research area that we are also heavily involved with, and I've worked with 2 PhD students at least from spatial sciences on, is what we call precision environmental health and exposomics. And we actually also just got a center funded that's going to be coordinating the research space for exposomics. And John also is a big partner with me on this center. And so what does it even mean, right? It means that we're using sensor tools, omic technologies, a lot of sort of high throughput data analytics to really measure what people are exposed to at the very personal level with wearables, with sensors, with apps, taking blood samples and analyzing thousands of components in them, and trying to put the pieces together to really look at one person's risk for adverse health impacts. And so to give you a couple of examples, Yan Shu, who graduated from the program, is now a postdoc working with me and with John. She really developed some sophisticated models for understanding personal exposure to air pollution in these pregnant women's lives that I was describing before. She and Li Yi, who is also now a postdoc at Harvard, really worked on advancing GPS activity space modeling methods to understand exactly where people are spending their time, what are they getting exposed to, how does that translate to their risk of adverse birth outcomes or physical activity levels, how does it impact their air pollution exposure, etc. So this is a very sort of tech-heavy, data-intensive field, and it is really looking at high-resolution measurements paired with modeling to kind of advance our understanding of how environment affects human health. And the last example I'll give you is around climate change and health. And as John mentioned, we just got a new center that we're very excited about. And again, John is a big part of studying wildfire smoke exposure and other things that I'll talk about in a second and how they impact health over the lifetime. But for example, one area of work that, again, I've had spatial sciences students work with me on is building air pollution prediction models. As I'm sure you all know now, we have a wide variety of sensors or monitoring networks out there, for example, citizen science networks that are measuring air quality at much higher resolution than we used to have. These are not in the same sort of high quality that we think of when we get regulatory data from the EPA, for example, but they do provide a very nice look at what's happening on the ground in real time. And so what we do is we take that data, we integrate it with satellite data or remote sensing, a lot of GIS variables describing important sources of air pollution or what we call sinks or mechanisms with weather data, and we could use machine learning to predict air quality at very high resolution, including wildfire smoke and other things that are related to climate. And so in this new center, we are bringing together an amazing team to really develop kind of more cutting edge models of a lot of these exposures that are related to climate change and these patterns that we're seeing. So that again includes wildfire smoke, and smoke is a really complex thing to model. It's not, one pollutant. It changes very quickly. It moves around. It reacts chemically. We're modeling urban heat islands and heat stress. We also have Dr. Kelly Sanders in engineering, who is looking at more system level kind of gaps in adaptation systems. So for example, can the power grid handle heat waves? Can it handle heat waves when we have wildfire events as well? Who has air conditioning? Are they, helping in these situations? And then Dr. Wilson is also bringing his amazing talent at thinking about urban vegetation and modeling urban vegetation, tree canopies, and trees in terms of what they could do to improve air quality, shade potential, and even just have their direct impacts on health. And I'm also co-mentoring a PhD student right now working on some of these methods. And so in the center, we're particularly looking at cardiovascular health in adults and children at different life stages. But as you can imagine, all these tools and data sets and models you can take and apply to any other health question or even social question of interest. And we're also working with other amazing faculty through spatial sciences in Children's Hospital, et cetera, to extend some of this work to other health outcomes. So I'm always happy to tell you more, but hopefully this gives you an idea of some of the research areas that you could be involved with. Passing it on to you, John.
Okay, thank you. So what we've done is we've told you about the personnel. Laura and Rima have told you about what students do and what they hope the outcomes will be in terms of pushing the frontiers of science forward and then linking that to policy and action on the ground. I think the faculty that find the most value in this program are pushing science forward, but also interested in policy and action as well. Because it's one thing to talk about the world, it's another thing to actually improve the world. And so now I just want to spend a few minutes talking about the nuts and bolts as to how you get from an applicant to being made an offer, to taking some courses, to get to the research that they've both so eloquently described. So this slide here summarizes the core parts of the coursework. And so, so far in the 9 years we've been doing this, I teach this class, the Geography of Life and Death. It's a pretty awesome name, but it's a big responsibility to cover both the beginning and the end of life and everything that happens in between. But you can then see beyond that, there's a population health and place research practicum that happens in the first 2 summers. In part, it's an excuse so that we can fund students 12 months a year for the first 2 years. In the first summer, the expectation is the Ph.D. students would produce either an empirical paper or a review paper. And then in the second summer, the expectation is that by the end of that summer, they could have a credible first complete draft of a Ph.D. dissertation, right? The only thing we can't manufacture in life is time. And so the goal is to see whether we can't persuade people to use their time purposely, right? And then around that, there are these 3 columns here. The one on the left is about health. So there's a class, Principles of Biostatistics, Principles of Epidemiology and Environmental Health and Ecological Approach there. On the right is the one about place. So spatial computing, principles of spatial data analysis, spatial modeling with GIS. And then in the middle, there's a group about demography. And you'll notice the 2 classes there have sociology prefixes, but one has a spatial science prefix. The spatial science class is about really statistical methods for the social sciences. And there wasn't the capacity to offer that on a regular basis in sociology. And so the solution was in social sciences here, we stood up the class ourselves. And then after that, there's typically 3 years in which you become a PhD candidate, and then you largely work on your dissertation and the papers that might flow out of that dissertation. Our model is that we're interested in clever, ambitious people. We welcome people with different backgrounds, with different interests and different aspirations. We want people that aspire to make a difference in the world. That might be the unifying concept. And so if you came with a master's in public health, then you'd likely swap out some of those classes on the left side for more advanced classes. If you came with a master's degree in geographic information science and technology, you might have some wiggle room to make some swaps on the right-hand side and so forth. So this is how we work. Next slide, please. And in some cases, you might have a whole column covered. And at that point, then, either because your interests speak to these topics or because these would round out your education, across the university, there's a large number of electives that students could pick and choose from. So that's the coursework. Next, please. So, there's every year there's an admissions committee that I chair. The good news is I don't have to do much work because what we do is we pick 2 people from the population pillar, 2 people from the health pillar, and 2 people from the spatial pillar, and they get a set of directions from me to find the students with the clearest and biggest ideas of what they want to accomplish both during and after they've completed this PhD program, and that have some skills and training that speak to what they want to do, and that the program would offer ways to round out, build out that competency so they could actually deliver on what they've shown to be their goals and aspirations. This next cohort may be either cohort 9 or 10, I've forgotten. I think it might be 10. But for the last, and the admissions committee composition changes somewhat every year. Some people have done multiple years, but some people just do 1 year and then drop out. But the beautiful thing to me about the admissions committee is that 2 of the last 3 years, the top 10 ranked candidates by all 6 people were identical. And the year that they weren't identical, the top 10 were the same people across 6 different people, but they just had different orders, right? And so my job is to break ties and worry about how much money there is and so forth. And two out of the last 3 years, there's no need to even break ties, right? Typically, we recruit 3 to 5 students every year. We're not interested in volume as much as we are in the quality of the students we recruit, and in particular the heft and the quality of the outcomes of the people we graduate. We make 5-year offers, so students that we make an offer to have guaranteed support for 5 years. There's now a union that represents graduate students on campus, and so we have to make offers within the parameters that contract speaks to. But this year, for the people that were recruited this year, they were made an offer of that's guaranteed a minimum of $40,000 a year for 5 years. There are 2 years that the student would be on fellowship, typically the 1st and the 5th. And the 3 intervening years, a student could win a competitive fellowship. One of the students I'll introduce shortly has that luxury. They could be a graduate research assistant, which is often the way that Laura and Rima, and sometimes I, have worked with students, or they could be a graduate teaching assistant. That could happen here, or conceivably it could happen some other place. In addition to that, we top up the first 2 summers. So if the offer if the union contract says $40,000 for the academic year, then we would make an offer. We made offers this year where the first 2 years there was a guaranteed $53,000 and change, right? So far that's worked well for us. Students have to pick 2 co-advisors from 2 of the 3 pillars. So they could pick somebody from spatial sciences in either health or population, or they could pick somebody from population and another person from health, right? We're ambivalent as to which ways that you construct that. The best idea is that you're going to pick the 2 people who are best equipped and capable and available to help you achieve your objectives, right? And that's worked well too. The next thing to say is that for the qualifying exam and for the proposal defence, you need a committee of 5 people, and that committee necessitates that you pick at least 1 person from each of the 3 lists. So 1 from population, 1 from health, 1 from place. Because the best candidates are going to be the candidates that speak about their interests and aspirations and convince us that they lie at the intersection of population, health and place, right? So we've structured the way the coursework works and then how you engage faculty so that we can double up on that, right? This is an unusual program because many PhD programs that I've been associated with, faculty put their hand up when they want a PhD student, and then the PhD student arrives selected to work with faculty member X, and faculty member X will tell them what they're going to work on, right? Students are uncomfortable here because for the first year, they're told to go and look at faculty and make their own assessments about who's exciting, who has good ideas, who they think would benefit from working with. And then after they've met with the Director of Graduate Studies, they might be then empowered to go and ask those people if they want to be on their team. So we've flipped the traditional framework so that the student is in the driver's seat. So if this was a road trip, we were driving to Phoenix this afternoon, and you'd asked me to be your advisor, then I'm the sidekick in the passenger seat. And it's like a road trip. If I tell you where to go, turn here, turn there, slow down, speed up, you're going to throw me out of the car because I talk too much. If on the other hand, you make a wrong turn, but I don't say anything, you'll be mad with me because we've gone 100 miles out of the way and we could have averted that, right? So we're very student focused by design, and the product here is you, and the outcomes for us are what you go on to accomplish once you've earned the degree. So with that, I'll turn briefly to talk about half a dozen students that have already graduated. So next, please. So the top one here is Rachel Wilkie, and you can see her dissertation topic here. She just graduated during this calendar year, and she's currently a postdoctoral scholar at the University of St Andrews in Scotland. The next one on this list is Michelle Livings. She graduated in 2023. This is, I told you had 5 years guaranteed funding. Michelle was kind to us. She finished her PhD in 4 years. In part, I think, because she really was really keen to get this postdoctoral research associate position in the Centre for Research on Child and Family Wellbeing in the School of Public and International Affairs at Princeton University. This particular cohort she used for her PhD dissertation. And so rather than being the consumer now, she's part of the team that produces and creates the data that are part of this ongoing cohort. Next one, please. So Avery Aberhart, 2022 graduate. She's unique because she took the geography of life and death class and then asked to meet with me, and she said, "So John, I want to switch PhD programs." Really? It's a thing? And it turns out it can be a thing. And so she started in one program and finished in population health and place. And she's now an assistant professor of GIS, cartography and transformation in the Department of Geography at the University of British Columbia. And then Lee Yi, Rima spoke about him. You can see his title, and he's a postdoctoral research fellow for the second year now in the Department of Population Medicine in the Harvard Medical School in the Harvard Pilgrim Health Care Institute, right? There's a pattern here. All of these four people landed in what I would call aspirational schools, meaning that if you looked at global rankings, they're above us, which speaks to the quality of these young men and women. And there's one more. Next. These are the first two graduates of the program in 2021, Joanna Avila Portillo, and you can see that she's had a couple of postdocs, and she's landed as a principal data and research analyst in the county of San Diego. So she's working on the ground with real people, and so among the benefits might be that she can turn policies and programs into action and outcomes, looking firsthand at it. And then Douglas Fleming was the very first graduate of this program. He's a GIS project coordinator for the Centre of Disease Control, Geospatial Research, Analysis and Services program. And he's an example of a student who had advisors from the population domain and the health domain, but not the spatial domain. So next. So here's 6 of our current students, but rather than focus on them, I think one of the people are here present, and there are 2 other of our students. So I think they could say briefly about maybe something about their background, how they got here, and what they're doing. And maybe Andrew, I think we can start with you.
Yeah. I'm Andy Camschulte. I'm starting my 4th year now in the program, and I came here non-traditional route. So I'm from Michigan originally. I got my undergraduate degree in biology. Then I did my master's in biostatistics. And then I worked in the private sector as a research statistician for 5 years at a health system. And what brought me out here is during COVID, I was doing a lot of geospatial analysis of disease modeling. And I really wanted to become better at it and learn more about the intersection of health and place. So that brought me out here. And right now I'm a predoctoral fellow at Children's Hospital Los Angeles, working with Jonathan Tan out there, and John Wilson is my other co-advisor, and Rima is my very supportive committee member. And yeah, that's me in a nutshell.
Okay.
Hello, I'm Laura Messier. I'm a third year Ph.D. student here. I guess I also have a non-traditional background. Is that like the theme of the program maybe? So I have my bachelor's in architecture from 2008. So it's been a while since I've been in school. I was practicing architecture for many years. And then kind of started getting interested in, how do I explain this? It started with sidewalks. But started getting really interested in kind of the policy aspects around built environment. And while I was living in Dallas, went back for my graduate certificate in GIS. So that was kind of my first experience in GIS to kind of test the waters to see if I would be interested in kind of a bigger commitment. And so really enjoyed that, and ended up finding this program, which I think is a really great intersection of kind of all of these different things. So basically I'm interested in built environments and the way they impact behavior and health, and especially kind of the policies that shape built environments. And like John said, so this is sort of random, but ended up applying for the NSF Graduate Research Fellowship and got funding through that, which I would highly recommend for anyone, because it does provide 3 years of funding, which kind of takes the pressure off a little. First, last year, I spent a year as an RA for John's Urban Trees Initiative, which was really, really great. I think those are kind of the highlights, I guess.
Were you gonna say something?
No, you're next.
Hi, I'm Angela Zhang. I don't know if my route is traditional because I don't know what a traditional route is, but I graduated with a degree in math and CS from UCLA. And in my senior year, I was pursuing like I was planning to be a software engineer when I graduated. But then I took a class in environmental literature, which was just like an interest of mine. And we had a section on food environment, and it was like right in the middle of the pandemic. So I think I saw a lot of issues that I was in that class with food systems that I also saw in the news with like a ton of food being wasted. But at the same time, people like food insecurity rates were spiking, and also like frontline food processing workers were like some of the most affected by the pandemic. So I really got interested in this topic of like food systems, and that's kind of, I took that and ran with it. And so I kind of pivoted in my senior year into more research about sustainable food systems. And then I took 2 years after graduation to kind of work in research and then the nonprofit space, looking at more community food access. And then I came to this program, and now I'm still doing stuff around the food environment and interested in how that impacts health disparities. And I'm also RAing with the Southern California Center for Latino Health. And I forgot to mention that I just started my second year. Yeah.
Okay. So these are among our best students, but all our students are best students, right? And so we could pick any of them. The others that are represented on the slide here are equally accomplished. and at various stages of the program, and they have similar diversity in terms of their backgrounds, their paths to this place in life, and in terms of their interests and aspirations going forward. So next. With that, I think the best thing to do is for people who have questions to ask them, and we will all try to provide answers. So we probably have 15 or 20 people online. We have 2 sitting here live, so perhaps we can start with you.
Okay, hi everyone.
Yeah.
I am Anaya, and funny because I'm also sort of non-traditional, but my question specifically, I think there's so many amazing things that this institution does and these amazing professors. How do you feel though on the level of still receiving the mentorship that you need to continue the work? Like, how is it, especially if they're doing all these other amazing, great things?
Yeah, so as John said, the program is designed to put you in the driver's seat. So if I'd recommend to anybody, any student in this program to really know your needs ahead of time. I felt like I came into this program knowing that I did not need a micromanaging mentor. I needed was fine with a more hands-off approach. So both of my mentors are notoriously busy and I'm okay with that. So yeah, you get 2 years to really figure out what you need out of a mentor and to find that and develop that relationship with somebody.
So I would just add on, I think that you really get out of it what you put into it, as with so many things in life. So I think I found people really willing to meet and just have conversations. So the first 2 years, if you just email people and say, I'm interested in your work, this is what I'm interested in, do you have 30 minutes to meet with me and have a conversation about that? I think people are really willing to do that. And beyond just finding your committee members and your advisors, I got a lot of really good feedback, good useful feedback about different ways to think about things. And and it also kind of further build your community within USC and kind of gives you this network of people. So I would always encourage people to just reach out, send an email. Like, the worst that can happen is someone doesn't respond. And then maybe you need to ask another professor that you know to kind of help you connect with that person. But I found people really willing to meet. Yeah.
Depends what time of year. Don't email them in a grant cycle.
Yeah.
Or end of year holidays or something.
So Angela, you're in the middle of this, so how do you feel?
Could you clarify the question? Was it like, how do you pick an advisor, or?
No, more so because everybody is so amazing and doing all these amazing things. Like, how do you feel the support is as a student?
Oh, like,
yeah.
I think I would echo what Andy and Laura said. Something that helped me a lot was talking to other students and not just professors about working styles. And I feel like I learned so much just by talking to people like Andy and Laura who have navigated the program before me. So there's a lot of, I guess, embedded knowledge there. And yeah, just talking to people, having conversations.
I would echo what Angela said in terms of the support network of other people in the program. I think things that I've heard from other PhD programs that might be more narrowly focused in a given field, I think one thing that really sets this program apart is that we all have really different interests and there's space for everyone. And I feel like we're all really supportive of each other's work because we're not really competing for the same opportunities in the same space, has been my feeling.
Between any of us.
Yeah.
We all have our own plots of land and.
Andy doesn't care about sidewalks at all.
Yeah. I don't know to talk about it, it's great and it's inspiring, but it's that's never gonna infringe on what I do.
I think I have some overlapping research interests with ESCAR and people in the past who have graduated now, but I feel like it's been like really collaborative, and we just like talk to each other about our ideas because we all are like, because we're in the driver's seat, I feel like there's a lot more responsibility and ownership over our dissertations. So I feel like it'd be really rare for someone to be doing like a very similar dissertation topic because we all come from such different backgrounds, and yeah.
I mean, the other thing about the relationship with faculty that I think is empowering for the students is that they already have a funding package. They might be able to improve it by how they choose co-advisors and perhaps what their topic is. But if they don't have to do that, right? And so, you know, most times a faculty member gets an intro for somebody that wants to come and work with them. The implicit expectation is that they're asking if the faculty member has money to support them as well. And that's not the case in this program. If you've been admitted and you're in the program and you're on campus, then you're already in a good place to make up your own minds and then make your own assessments and then make your own offers, see whether they accept.
There's a question on the
Yeah,
chat.
I can take it from the chat first.
On average, how many days a week are classes offered per term? How many classes do we take per term? Perhaps you three.
Be honest with that. So between 2 and 3 classes per term. If you take 2 classes in a term, most likely you're going to go beyond taking classes your first 2 years. So in some semesters I took only 2 classes. And so I have now 2 classes, my last 2 classes to take this fall semester, my 3rd year, which is completely fine. So it just depends. I know at least one person in my cohort is completely done with their classes because they were able to take, I think, 3 most semesters or maybe an extra class in the summer or something. So yeah, I don't know what you guys did.
It's honestly the course load for this program is not overwhelming. It's still challenging, but yeah, 2 to 3 classes per semester I thought was really reasonable. In terms of days of the week, that depends entirely on what the class is and what school it's in. So I mean, I remember my first semester, all my classes were on Monday and I didn't have anything the rest of the week. And then others, it was just a Tuesday, Wednesday, Thursday melee. So it's just up to the gods of scheduling at USC.
Yeah, I would say, I mean, I feel like it's pretty flexible if you want to take 2 or 3 classes per semester. I was given the advice to front load my classes in the first year. So I took 3 both semesters, and then I think the 2nd year you start having like more additional responsibilities, like putting your committee together and recruiting advisors more seriously. So as well as like TAing or RAing. So I think it's a lot of people more often take like fewer in their 2nd year compared to the first.
Okay, next question is, somebody else can answer this if I don't know the answer. Are there research opportunities in the areas of complementary and integrative medicine?
Would you like me to take a stab at that, John?
If you like, then Laura will follow.
Sorry, Laura, I couldn't see if you were.
Go ahead, Rima, go ahead.
And honestly, I'm not sure exactly what you mean by complementary and integrative medicine, but public health is a very large sphere, and there are lots of sort of domains within public health in which you can be thinking of sort of non-traditional health questions that are not dependent on sort of medical intervention. So what do you do to prevent disease? But there are also students who have come through the program who have partnered with medical school researchers to look at things in the sort of the medical world more. It's not a medical program per se, but you could definitely be studying different elements or, you know, aspects of things related to healthcare delivery or medical services or other types of programs. Laura, do you have anything else to add to that?
Yeah,
Sure.
and just to add that there are faculty here working on like Eastern medicine and other traditions that I think bring very different paradigms to the table. I can't speak to, like, do they have research opportunities open right now? I don't know, but there are definitely people here doing super interesting work in those areas.
Okay, any more questions?
Oh, yes, I actually stumbled upon this. I was coming to do my first lab set as an incoming HSGI. I'm a non-traditional student. I was here for Warrior Scholar Project in 2022 when I first found out about this program and prior service military. And so just what are some of the recommendations, if any? Would it be, I guess, the best choice to stay only in special sciences throughout my time here at USC, or maybe to have an interest where some of my radiology technology may bleed over into Master of Public Health to then come back to special sciences for like the Ph.D. program? Because I mean, basically encompassing all the other facets of what I've done and what I want to do. Like,
I think some people come with perhaps little formal training in population or health, but have great depth in spatial sciences, and same for the other two pillars. They maybe know nothing about spatial, but they know a lot about population science and demography. And then others have maybe, like Andy, an undergraduate degree in biology or something like that, and then a master's of public health, and then they come to this degree. And the unifying principle among all of them is that I think they've concluded to make a difference in the world, they need to be able to combine breadth and depth. And so what we're doing here is, you know, human health and well-being, if they were the, you know, broadly the desired outcomes, these things are very complicated. There's both things that a person drives by themselves, but there are at multiple time and space scales, other things that people decide that will have a huge impact on who they can become and how healthy they'll be from the beginning to the end of life. And so if you want to step out and make a difference in the world, you're going to have to work with lots of different people, with lots of different paradigms, lots of different backgrounds, interests, aspirations, and we're the initial motivation for this was twofold. So number one, we invited to USC one of the former Surgeon Generals of the United States, and the Keck School of Medicine Dean at the time invited me to come to the talk. So I sat in the front row with the Dean and so forth, and he told a story about the fact that, you know, he was American, but his wife started life in, I think, Costa Rica or El Salvador, somewhere in Central America. And he reflected on the fact that when his parents got older, we put them in a very nice home with a lot of people in the same state they were. And his mother-in-law, as she got older, was moved to the front porch of the first house you saw when you came to the village. And whatever you needed to know about the village right till when she was in her 90s was to be got from stopping and speaking to her. She knew everybody's secrets. She knew everywhere to go. Her mental agility was with her whole life. And he wondered whether in the United States writ large we were doing the right thing by putting people just a little bit older than me in a old person's home, right? So that was motivation number one. Motivation number two, the very first postdoc I recruited at USC came from the Department of Population and Public Health Sciences. First few months, hugely successful. She wrote a proposal, she got a grant. 2 or 3 days later, she comes into my office and said, "We're going to give the grant back, John, because I've got a better offer." And so she went to the statistical division of the Centers for Disease Control, and there was a principal investigator there that wanted to build a life expectancy map of the United States by census tract. Right? And lo and behold, when she did that, took 2 years. She was a key part of the team. The lowest life expectancy was some central tract in Mississippi, expected age 53 years or something. And the longest you could live was if you were lucky enough to be born in a census tract in Washington, 97 years. There's 44 years difference between the worst performing place and the better performing place, assuming longevity is welcome. But what really struck me about that was just how big the disparities were. But then second, there are many parts of the world where the average life expectancy does not even meet the difference, 44 years, right? And so there's just a lot of work to be done so that we treat every person with dignity and we give everybody a chance at a long and happy and healthy life. And there's nothing more important than that. So that's what we're going to, right? Okay, we want to wrap it up now, I think. Last comment, Rima?
Not really. I think I heard you mention radiation technology, and sorry, I couldn't hear what you asked fully, but I also think if you're interested in that or have that kind of background, all sorts of medical imaging now requires machine learning, spatial techniques to analyze different patterns of disease. So that could be something to think about. Thanks, John.
I would just say, look, as you've heard from the students here, I don't think there is a traditional route into this program. This is not a traditional program, but it is a sufficiently flexible program to help you build up the pieces that you don't have already. And I think that, so it's just about you can build up the stuff that you want to build up beforehand. That's awesome. Then you bring that with you, and then you look at what are the other pieces that the program can then add onto that.
Okay. Thank you. So for those online and those that are going to watch it asynchronously, you could always write to me and perhaps Laura or Rima if you have any further questions. But we welcome any and all applications, and we will do our best to recruit the best class possible. Thank you.